Hello nurses and friends of nurses. This is the start of a series on the effects on health of EMFs, or electromagnetic frequencies, or also what's called radio frequencies, dirty electricity, all of the things that we're exposed to. So the purpose of this channel will be to go by each system, body system, including emotional, neuropsychiatric, also the different disease processes and how EMFs have been shown, proven by research to affect different body systems and disease processes. Glucose, many of your different cancers, glucose like your diabetes even, Alzheimer's, Parkinson's. You look at this group of people. I just read recently that there was a resurgence, just a massive amount of people being diagnosed in their 30s with Alzheimer's. And what is that about? We can put it up to bad diet, GMOs, whatever you want, but there's got to be a reason, another reason too. And what is setting all this off? And I really do believe that our use of EMFs and our overuse might be contributing to that. So today, the very first one of these mystery illness topics is going to be on cortisol. This isn't exactly an illness, but what it is that people can have high and low cortisol, and both of those are very dangerous. They can both cause massive problems with the body. So let's go ahead and get started. I found this one really interesting. It is with dentists and low cortisol, and then a small little study that I found, and you can find lots of studies that aren't with healthcare workers, that was done with physiotherapists and nurses and high cortisol levels. So let me just give a little background for those of you that are watching this and not familiar with cortisol and what it is. It's a hormone that helps the body remain alert and respond to stress by influencing reactions in many different organs and systems in the body. Now, cortisol is made in the adrenal glands, and the adrenal glands also, they're located right above the kidney, just a little gland above each kidney on each side of your, on the tops of your kidneys. They have the gonad corticoids, which is your estrogens and your androgens, your sex hormones, some of them. And then also norepinephrine, epinephrine, you've probably heard of that. Let's see what else. Yeah, that kind of thing. And cortisol helps maintain blood pressure and cardiovascular function. It slows the inflammatory process down. That's why you might get a little shot of a cortisol shot of some kind if you are having a real bad allergic reaction, or sometimes they'll do it for seasonal allergies, or they'll give you prednisone for swelling, that kind of thing. But too high or too low, and a lot of people don't realize it, but too low can be just as dangerous. Now, when you don't have enough cortisol, it really can disrupt your metabolism. One of the things that can happen, that can cause low cortisol levels, is having such extreme stress that it literally wears the adrenals out. Different disease processes can do this, injury and that kind of thing. But right now we're going to be looking at a possible cause of low cortisol levels, and we'll do that in a minute after I get done with symptoms associated with them. So symptoms associated with low cortisol they can be confused with other disorders, specifically fatigue, headache, weakness, dizziness, orthostatic hypotension, which is, standing up quickly and your blood pressure drops. Let's see what else. Oh, yes, an inability to tolerate cold temperatures. Doesn't that sound a lot like low thyroid? So nausea, vomiting, diarrhea, those are some other things too that can be associated symptoms with it. So when left untreated, they can progress into, that's the early phases, muscle weakness, weight loss, dehydration, irritability, and depression. Social anxiety, inability to cope with stress, being out in large groups of people can really bother people with low cortisol level. Anxiety, extreme craving for salty foods, clumsiness and confusion. Now, high cortisol levels are the opposite, where the adrenals are pumping out too much cortisol, which is normally in the response to a stressor, or it could be that your body's decided that it doesn't like whatever the allergen or something that it's sensitive to. It will try to protect it. You'll have symptoms of unexplained weight gain, acne, skin infections, lesions, thin appearing skin, bruising, growing facial hair, and reddish purple streaks on the skin. Now, here's where some of the are similar to the low cortisol levels, which is pain, weak muscles, depression, irritability, headache, anxiety. Now, for cortisol levels to be high, you can end up with high blood pressure. So looking at, you talk about why does stress cause high blood pressure? Well, one of the big reasons is high cortisol levels, and that's why they say reduce the stress. Let's see. Oh, another one too that's interesting with high cortisol symptoms is gender-specific changes such as women developing male pattern hair growth, irregular menstrual cycles, low libido, and infertility. All right, so I have here I'll have these linked. There's two small studies that were done, and the first one is on occupational exposure of dentists to electromagnetic fields produced by magnetostrictive cavitrons alters the serum cortisol level. This one is done in the National Journal of Science and Biological Medicine, 2012. In this case control study, blood samples were collected from 41 dentists and dentistry students, 21 of whom were exposed to EMFs emitted by the cavitrons, and 20 that were not. Then that would be considered the control group. So you have 21 that were and 20 that were not. Now, what a cavitron is it's a type of scaling electronic generator. It's an ultrasonic scaler, and a scaler is something that is used to remove plaque and calculus from the exposed supragingival surface on your teeth. You know, they'll run that little vibrating thing over your teeth to get rid of all the plaque and things like that. So they have different ones. They have ones that are done in the States, and they, I honestly think that they're a type of Dremel, really, because they look just like a Dremel tool. In fact, I should ask the dentist if that's what it is the next time I see him. And then they also have one that's interesting in Europe and Asia, and that one uses vibrations of a quartz crystal in a handpiece. I found that interesting. They would use a quartz crystal. Now the tips on the ones that the United States uses are interchangeable. That's why they like them. So we don't really need to know that. What we really need to know is what happened to these people. What happened is that half of the group did not, the dentists and dental students, ones that were in the control group, did not use any kind of these devices during the day, and they took their serum levels, their cortisol levels, and it decreased from 189 to 136, and that was after stopping work, and they did not consider that statistically different. But on the other hand, in the EMF exposed group, the cortisol level decreased from 157 in the morning to 88, or almost half of the level. And since it plays such a role, cortisol is such an important role in blood pressure regulation and things like that, you really can see where this could be a problem. This was a small study, but there's other studies out there. Some of them are on the fence about whether or not this is actually happening or not. But honestly, the idea that they're even looking at this, I found interesting. All right, the next one was on two groups of nurses and physiotherapists. And what they did, it was a small group, and the exposure was to a 2.5 gigahertz magnetic field, low frequency. They had 2.45 gigahertz actually is a router, which your router would be. And but they had it in a, they don't say how this was being performed or anything else. It was in Bulgaria, and the physiotherapists and the control group of nurses, what they did is they measured them at the similar age group, the length of service that they had been working at this facility, and they and also the different shifts that they were on. And what they found out, after they assessed the cortisol, the things that the adrenal glands put out, the cortisol, adrenaline, noradrenaline, and they found out that the cortisol levels, excretion rates of the stress hormones, those three stress hormones, was off the charts compared to the control group that were not exposed to this. So the whole idea, they said that the calculations of the EMF exposure showed levels above the ICN IRP guidelines. Now that was those were guidelines that were put into effect for international. Doesn't mean that it was a guideline that it took health into consideration. And like I've said before, our FCC does not take health into consideration when they're exposing us to these electrical fields, these radio frequencies, or anything else like that. Especially if FCC with the radio frequencies is just unreal. So the authors concluded that electromagnetic fields influence excretion rates of stress hormones of the medical staff. Now, like I said, I just picked those two little ones out just for now because this is the first in the series, and you are healthcare workers, or you're friends of healthcare workers, or your relatives, or whatever, or just interested. And I thought we would start with that. I am going to be doing some more. I'm going to start with neuropsychiatric effects, such as what you saw there. Neuropsychiatric effects, depression and anxiety and electromagnetic fields. Parkinson's, which is very interesting that you're seeing people in their 30s with Parkinson's, and with Alzheimer's, and could it only be the food that they're eating? And what's going on? Why is this happening? A lot of people say the vaccines are causing the autism. I tend to agree with that to a point. I do believe that there's more to it than that. And there's just tons and tons. We could do this series for years on studies that have been done and how these are all coming to light. My goal is that you will look at these and at least think outside the box. Maybe right now it's kind of, skewing your bias about things, but think about it. Cigarettes were considered healthy. In fact, doctors, I have seen the ads for doctors, even into the late 50s, were promoting it for health. Could this be the next smoking gun? Is electromagnetic frequencies, and maybe we need to be learning how to take care of ourselves and to mitigate these, to learn to work with electricity so that it's benefiting us and not harming us. So that is the whole point of this series, is to help you start thinking outside the box. Anyway, you have a wonderful rest of the week, and I'll see you at the next video. Bye.